everyone, I'm Erika Bennett with South Georgia Medical Center, and I'm here today with our President and Chief Executive Officer, Mr. Ronnie Dean, and our Chief Medical Officer, Dr. Brian Dawson. And we're here outside of our Allspice Cafe on our South Georgia Medical Center main campus on this beautiful November day. Mr. Dean, this time of year everyone is participating in open enrollment, and we did have some communication, some news that we wanted to inform the public regarding our health insurance exchange. Can you tell us a little bit about that?
Absolutely, and thank you, Erika. It is a beautiful November day. It is Thanksgiving week, and we have a lot to be thankful for. Health insurance. Erika, the viewing public, knows these things I'm about to say, but there's one part of it we'd like to reiterate. Many of us receive health insurance coverage through Medicare and Medicaid, and then others of us receive health insurance through our employers. And then there are others who buy their health insurance through private brokers. And then through the Affordable Care Act, there is what is called the health insurance exchange that was made available to consumers. It's subsidized health insurance products that are made available to geographical locations based on the insurance companies that provides health insurance coverage in those locations. What we want everyone to know is that when going on the health insurance exchange and looking for the health insurance product of your choice, be mindful of the network of hospitals and physicians that are included in that health insurance products network. To be in network is to have a lower out-of-pocket cost. To be out of network is to have a higher out-of-pocket cost. And in our particular case, whereas the Pathways product that has been offered in our area no longer includes South Georgia Medical Center and our physicians, the Ambetter product does include South Georgia Medical Center and our physicians in their network. So we're encouraging everyone to select Ambetter if you want to use South Georgia Medical Center and our physicians in network. You can still use us out of network, but it may cost you a little bit more out of pocket. So we're just letting everybody know. It is quite confusing to the consumers, to be honest with you, and insurance companies make these changes this time of year. So we have between November 1 and December 15th to make those choices. And we're asking everyone, if you want to use South Georgia Medical Center and our physicians in Lowndes, Berrien, and Lanier counties, pick Ambetter. That's the choice for in-network coverage.
Perfect. I know it definitely is kind of confusing when you go on those exchanges. So Ambetter is in network with our facilities. So important to know. So be sure to check out our website and make sure that you're selecting a plan that's in network to use our facilities. With Thanksgiving coming up, COVID-19 has not gone away, unfortunately. Can you tell us what you're seeing in the hospital?
Well, let's talk about nationwide. It's still here, everybody, and it's unfortunate, and we're battling hard, and this community's done a great job. And I guess what's on my mind today is that we should not let our guard down. We do have an increasing number of positives in the state of Georgia and the region, but fortunately, Erika, we have not seen the hospitalizations that we had back in July and August. As a matter of fact, today, I believe 25 patients are in this hospital with that diagnosis, and only a couple are on mechanical ventilators. And that's still too many, but it just reminds us that it's here, whereas in the Midwest and other parts of the country, it's really raging out of control, and the news is covered, and I'm sure the viewing public sees it. What I would say to everyone is let's just continue to be about what it is that we've done to control the COVID spread in our community over the last several months, and that is continue to wear the mask, practice social distancing, and wash our hands. The Thanksgiving gatherings are going to pose a great challenge, and folks will figure that out, I'm sure, how to do that safely. And hopefully, within some weeks, we'll have a vaccine. The vaccines are what I really want to highlight. We have Dr. Dawson here, and he's going to speak specifically about them. There's vaccines and new treatment that we are looking forward to here at South Georgia Medical Center. Pfizer and Moderna, and I believe another, maybe Astra, Zeneca is now saying vaccines will be available in the coming weeks. So what I would say is, whereas we've been running a drive-through testing site, I can imagine out at Smith Northview that we'll begin to have drive-through vaccinations sometime in the near future. As a matter of fact, we're partnering with the Department of Public Health to figure out how to distribute the vaccine efficiently throughout the community. They have lots of resources. We do. We want to be a partner for the community's benefit. The vaccines come with a lot of questions, and I'd like for you to talk with Dr. Dawson about this today and let the viewing public hear his comments on that, Erika.
Certainly. Thank you, Mr. Dean. Dr. Dawson, thank you for joining us today. From a clinical aspect, what can you tell us about the COVID-19 vaccine?
So there are 3 current vaccines that are going to be available in the very near future. One of these is made by Pfizer. The second that came out was from a company called Moderna, and then AstraZeneca, I understand, just in the previous 24 hours has completed studies on theirs. So we should have several options available in the near future. We've worked very closely with the Department of Public Health to communicate with them what capabilities we would have in the near future. We've been told early on that we would have about 900,000 doses for the entire state of Georgia that should be here by the end of the year. Of course, that's subject to change, and we're ready to change for that. At South Georgia Medical Center, we've begun plans so that whenever we do have access to this vaccine, that we'll be able to utilize our drive-through screening station at Smith Northview Hospital campus, that we can have individuals come in there and receive their vaccines. That's still in the planning phases, but we're ready to convert to that if need be. And if necessary, we have additional vaccination sites that we could potentially open. All of these vaccines, the first 2 in particular, have been shown to have about a 90 to 95% efficacy at preventing the virus, and they actually use a very new technology that makes this a very safe method of not only preparing but administering vaccines. The other thing that people need to know is there's going to be a 2-dose regimen where you get 1 dose, and then about 3 to 4 weeks later you get a booster dose, and after that you don't have to have any more doses thereafter. So this is going to be the first step to us getting back to a normal state of being in the United States, across the country, across the world. So I'm very excited to see that we're going to have this in the near future.
And I know there is a lot of skepticism about vaccinations, just in general. What would you say to ease any fears that someone might have in regards to taking the vaccine?
So number one, this new technology that they're using to prepare these vaccines is more sophisticated. The likelihood of having adverse reactions is much less. They've tested these now. Between the first 2 studies alone, it's nearly 100,000 people that have been studied all together with a very low risk of adverse events. Secondly is the concern that the disease itself poses. So what we know is that compared to the disease process itself, that these vaccines offer a significant benefit over being exposed to COVID-19. Even for those patients that may not pass away due to COVID-19, it can be disabling for a period of time before they recover.
Well, thank you for being here today. Anything else you want to share with us
No, ma'am.
for the holidays?
Thank you very much for having me. I appreciate it.
Thank you, Dr. Dawson. Well, we certainly have a lot to be thankful for here at South Georgia Medical Center. Great people, great physicians, great team just coming together, great community. Mr. Dean, how do you feel coming into this Thanksgiving holiday?
I'm optimistic. I mean, I think we're going to whip this thing, this COVID. It's been challenging, but this community stood up to the challenge. Our 2,700 employees, 400 providers, physicians, our volunteers have all risen to the challenge. And Dr. Dawson just gave us some very exciting news about, I think, what's really going to help bring this thing under control. We just need to trust in the science, and we need to do what we've been doing. Use, our ability to keep ourselves safe until these vaccines come. And when we, have them, hopefully we'll have it under control. But I am thankful for that. I'm thankful for you, Erika, for helping us get the message out. And Dr. Dawson and all he does, he's a fine example of the quality of medical staff we have here and all of our employees. This is a Thanksgiving week, and I'm thankful for that. And I'm thankful for this community for putting your trust and support in us, allowing us to care for you and your family. Our goal is to never let you down. For that, I'm very, very grateful.
Thank you, Mr. Dean. We want to wish everyone a very, very happy Thanksgiving. Everyone stay safe.